the sheriff's office.
So I
No,
got some little clarification.
I stopped. COVID-19.
Heard us,
Oh,
but
okay.
we'll see what Marcy has to say.
Okay, I'll introduce it right away.
I don't, well,
Just what we're here for and then
do we go for?
supposed to be, she was all excited about it.
Yeah. I thought Judy invited her.
Yeah, she did. Along with pizza.
Texted us, there's my chair. Richard said, it's supposed to be like a Zoom.
I don't have anything to do.
You don't mind if I sit right here?
Oh, Sue Gordon. Hi, Sue.
Fit in. It's got no arms. It's like camera.
Which is sort of
All right, we're streaming.
It's what?
We're streaming live now.
So when it's kind of recycle center.
Hi, Dero.
I assume that Richard did this with his dad. That's
because usually we don't. So what you're hearing is fantastic, incredible.
And Michael, you guys.
No, this one's Bill's.
Process.
I wasn't, I thought I
All right,
was
I'm
gonna
going to
get
open it up.
back to the
No, just
paperwork
mark.
before here. Didn't happen.
I get it.
I'm glad I got it. Okay, thank you. Yep.
It's just a special.
Okay, you guys are on camera.
Good?
That's what all yours is like this.
Yeah.
Away from the
I'm
camera.
typing into a
Can
microphone.
you do that never work right? Even though I'm cracking the bottle.
Oh, I know.
We are just this, so I
Yeah.
It just came off way too easy.
That's why I started.
I didn't even.
She'll call it.
Chances.
So that I don't.
I do, I just can't print it, but it's not the end of the world.
Probably should have.
I just been so
Yeah, so
busy.
you can, so we can talk to
Let
everybody.
everybody know the mics are on.
Mics are on? Mics are on. Did Megs pick up everything? Where's the live link? Oh, okay, all right.
Unless you do set it down and
Oh, you have it on my computer.
then you have to copy it.
Okay.
But you would just copy the piece.
Yeah, right, duh. Okay. Thank you.
Supervisor, if you're ready? John, you ready? Keith? So good afternoon and welcome to our special meeting of May 8th, 2020. And today is our maiden voyage of our Zoom launch. So we appreciate your patience as we move forward in our IT. And we are very grateful that we have one of our technicians here to help us through this today. Sorry, Chair, I'm trying to get this turned down. Okay, so you want me to wait? No. Okay. So the teleconference information for anybody who's interested is on the website, and it's also under the Board of Supervisors agenda. We're going to start out with the Pledge of Allegiance, and Supervisor Brown, would you please lead us today?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
For those of you on the conference call that are unable to make it on the Zoom, we would like to ask any department heads and then staff and then public to identify themselves. So we'll start with the department heads.
Good afternoon, Board. Margaret Long, County Council, and we can see you and hear you perfectly on Zoom. It looks great.
Thank you, Margaret. Welcome. Anybody else?
Good afternoon, Shanna White, Trinity County Clerk Recorder Assessor.
Welcome, Shannon. Glad to have you with us. Anybody else? Okay. How about public? Anybody from the public on the phone that is not on Zoom? Okay, so we're going to bring it on back and fall in line with the rest of our agenda. Clerk of the Board presentations, item 1.1, adopt a proclamation of appreciation which recognizes May 6, 2020 as National Nurses Day. Thank you, Dr. Coons, for bringing this to our attention. Especially at this COVID time, we want to recognize and thank each and every one of our nurses, and as there's no one here to receive it, we will make sure that someone local does. Oh, Marcy, you'll receive it. Okay, so we'll talk afterwards. So, a proclamation of the Board of Supervisors of the County of Trinity recognizing May 6, 2020 as National Nurses Day. Whereas every day, nurses provide quality, compassionate, and critical care to patients during both routine medical visits and in times of great vulnerability, fear, and uncertainty. On National Nurses Day, we honor and celebrate the extraordinary men and women who devote themselves to this vital and noble profession. And whereas nursing is not merely a vocation, it is a special calling to serve others selflessly, particularly in times when help is needed most. Throughout our nation's history, in times of war, natural disaster, medical emergencies, and both epidemics and pandemics, nurses have rushed in, undaunted by danger, personal sacrifice, and discomfort to provide hope, help, and healing to the people in need. And whereas few times has our reliance on nurses been more profoundly evident than during this coronavirus outbreak, in the midst of this crisis, nurses have displayed incredible examples of humanity, selflessness, and sacrifice as they have fought to care for their fellow citizens and save lives. Nationwide, in hospitals, clinics, and other treatment centers where Americans are suffering from the virus, these warriors have steadfastly provided remarkable care and vital assistance to patients. In spite of fatigue and the threat to their own health, nurses soldier on in combat against this invisible enemy. Often the first to treat patients in our hospitals, they provide critical support to doctors, alleviating burdens throughout the healthcare system. They are adaptable and capable of enduring and overcoming unbearable hardship, immeasurable stress, and tremendously long hours, and extreme mental and emotional exhaustion, so that they and others may live. Nurses are awe-inspiring and truly worthy of admiration and praise. Whereas nurses reflect the character of America and epitomize the inexhaustible capacity of the human spirit, these remarkable caregivers exhibit professional expertise, selfless dedication, unrelenting advocacy, and unsurpassed mercy, strength, and compassion. Now, therefore, be it proclaimed that the Board of Supervisors of the County of Trinity proclaim May 6, 2020 as National Nurses Day, duly passed and adopted this 8th day of May 2020 by the Board of Supervisors of Trinity County. So, normally we would take a picture with the board, but because of social distancing, we'll just have to put that on hold and we'll receive a
Motion so made to accept the present.
second.
Did you want to have public comment?
I don't think there's anybody on the public phone. There's
Presentation.
29.
There are. Wow, how did we not get anybody? So is there any public comment on this item?
There is Veronica wants to speak.
Yes,
About this.
ask her if it's about the proclamation.
I'm here, can you hear me?
Is this about the proclamation?
Kind of, I'm just trying to find out how you want to run public comment for anything. If we're on Zoom, because she's saying phone, and so I don't know if that's something separate from this Zoom meeting. Like, I raised my hand so that you could recognize me. I'm not sure how you want to have us reach out to you for
Okay, so
things.
I'm sorry that you didn't hear that at the beginning of the meeting. So on the Zoom, if you raise your hand, the clerk of the board will be able to see you. And now if you're on the phone, that's why we asked if there was anybody on the phone specifically, because we cannot see you. That is not on the Zoom. So we'll be opening public comment in a moment. Right now, we are just taking input on the proclamation for the Nurses Day.
Thank you very much. Thank you.
So hearing none, I'm going to bring it back to the board. We have a motion and a second.
Supervisor Morris?
Yes.
Supervisor Finley?
Aye.
Supervisor Brown?
Aye.
Supervisor Groves?
Aye.
Supervisor Chadwick?
Aye. Thank you. County matters. These items include non-routine or controversial matters and are listed in alphabetically by department. A member of the board or staff may request that an item be heard out of order. Item 2.1, discuss and or take action to direct the county administrative officer, director of health and human services, and public health officer to institute an accelerated reopening plan for Trinity County pursuant to the governor's most recent actions regarding COVID-19. No fiscal impact. Dr. Coons?
Thank you, Madam Chair, members of the board. Yes, it's ironic it's the most recent because this is a fluid thing and it's happening every day, and we just got information right before we came into this meeting. So we're going to give you the most up-to-date information we have regarding the governor opening up and moving California to phase 2 with the restrictions on the state and what it looks like for Trinity County, allowing us through testing to move quicker through phase 2. So I'm going to ask Marcy to come up and explain the testing process and move us into phase 2.
Good morning, Madam Chair, Supervisors. Thank you very much for the opportunity to update you. As you know, Governor Newsom has laid out a roadmap.
Excuse me, Marcy, we're just going to deal with a quick
Sure.
technical. I don't understand. Yes, I think so. Yes.
Oh,
Can be seen there.
okay.
The camera can.
Marcy, why don't you, I'll move over and you can just take my seat. No, no.
I have it's right here, it's a separate person. You can see it right there.
Oh, okay. Thank you. Thank you, Supervisor.
I have a question.
Regarding technical stuff?
Yeah, the agenda.
I'm sorry, Marcy.
So,
People see.
Are we hearing information on phase 2 or the accelerated program?
Well, the accelerated program is part of phase 2.
I agree, but I just want to make sure that we were going to hear that accelerated piece.
Yes.
Okay, thank you.
Good morning. Thank you, Madam Chair, supervisors. So as you know, the governor laid out a roadmap for counties that qualify to accelerate modifications to the stay-at-home orders within phase 2. We can accelerate within phase 2 leading up to but not going beyond phase 3. Last night, local health departments, including myself, were on a call with the California Department of Public Health and were provided some guidance on the criteria and the documentation procedures required for this accelerated process. As Trinity County has met certain criteria in containing COVID-19, to this point we will be pursuing this variance. We must certify through submission of a written attestation signed by our health officer the ability to monitor, mitigate, and contain any increased COVID activity as a result of the accelerated modification of the orders. The attestation is done in consultation with partners and must be accompanied by letters of support from the County Board of Supervisors as well as our hospital administration. The attestation provides for a detailed plan and must demonstrate that we are able to meet the following readiness criteria. Epidemiological stability of COVID-19. Basically, this is demonstrating that there is not more than one COVID case per 10,000 persons in the past 14 days prior to the attestation, and that no COVID deaths have occurred in the past 14 days prior to the attestation submission date. We must protect stage 1 essential workers. Those are our essential workers that are currently in place by providing PPE, continued telework for those that are most vulnerable for severe health outcomes related to COVID, sanitation of office spaces, etc. The testing capacity, minimum daily testing volume to increase to 1.5 per 1,000 residents. We are currently increasing our testing capability. We have gone from testing 9 individuals last week to 26 this week, and I can go into more detail if you'd like on what our strategies are around testing and how we're working to ensure our residents get tested that need it or that request it.
Would you want to do that now or later?
I'll do it now, whenever you want,
I'm
Supervisor.
very interested in how you plan and how you're planning to do this all around the county and how you're going to try to track down, or not track down, but to hit the thousands of out-of-county residents that we have, or out-of-county people that we have in the county.
So one of the ways that we're addressing the testing in Trinity County is we have begun to map out where the testing sites are. So one of the requirements in the attestation is that we have to demonstrate where those sites are that are within 60 minutes of our residents in Trinity County. So we have 3 sites. There's the Optum Serve sites that are the high throughput testing sites supported by the state. We have one of those in Humboldt County, there's one in Redding at the college, and there's one in Tehama County. So we're mapping out what areas of our community, our county, are within 60 minutes of those sites and the numbers of persons in those communities that have access to that site. We're also, to ensure equity, we're through grants, we're obtaining gas vouchers, and we'll be assisting persons in accessing testing at those sites if they're within that 60-minute drive, or we're also looking at those outside of the 60 minutes. How do we address people that need testing that are in the outlying areas that are further than 60 minutes? We have met with our Mountain Communities Healthcare District clinics yesterday. We will meet with every clinic and we will support them in testing. We will advance testing under the Tier 1 guidelines, those expanded testing, so it won't be necessarily all comers for the clinics. It's going to be very strategic, but we do have sufficient supplies now. That has been a big holdup. We do have sufficient testing supplies, the swabs and the reagent, to be able to test more individuals. We are also in consultation with a company called Verily, that is a state-supported company that has the ability to mobilize a testing unit in our community. So we are in communication with them, and we are expecting that we will be able to have some sort of agreement with them. We've talked with the clinics in our county, those on the southern side. I'm sorry that my geography is really bad. I'm not quite used to it yet in the 3 years, but we will have them placed at clinic sites. We're hoping clinics will partner with us, very much like the mobile mammogram unit that comes. So it won't just be clinic personnel that could access that. It could be any in the community that wish to access that. So those are our strategies. We've already increased testing this week up to 26 individuals. So we're starting to see some of those increases come about now. So that's where we're at right now. Is that?
Yeah, that brings up some concerns, especially in my district. Without some sort of mobile unit in Lewiston and Trinity Center, and I'm sure Hayfork has a clinic, so you have something there. And then again, I'm not sure how we get to all the guests that are here, or get to them.
So one of the things we're doing is we are putting out a health advisory on the OptumServe sites. We can certainly message to those individuals in a strategic way. We can't really force them to be tested, but we could certainly somehow message to them that that testing is available. We want to make absolutely sure that it's available to all those who need it. So there's a difference between surveillance and testing persons to see if they're positive or negative at any given time because they're at risk or they have symptoms. So the surveillance testing will be part of phase 4. We have to be able to do that in the third tier of the testing for the CDPH. What will be very valuable about surveillance testing will be the serology testing that hopefully will be available, because that once they are able to determine what's protective, it gives us a better picture of who's immune, if in fact they've had it and there's sufficient antibodies determined to be protective. So there's some things that...
So who's going to meet the criteria
for the tier 1?
So
we're going to develop a strategic plan. Basically in tier 1, it contains those 65 years of age and older that are symptomatic or asymptomatic because they're the highest risk, and those with chronic conditions. So we've talked with our clinics to ensure that their clients that fall into those risk categories have access to testing. We're also ensuring that our essential workers are tested to get a baseline testing on those essential workers, primarily those that are working in the facilities, but also before those that come back to work, come back to the office to work. That's just a couple of the strategies within that tier 1. There's others. We need our hospital to also ensure testing through some mechanism of healthcare workers, either through the county, through testing sites that are the Optum testing sites, or they conduct testing on skilled nursing facility residents, hospital staff. So we want to be very strategic about opening up testing and how that will be done. I think to your point regarding people that are in the county that may have COVID-19, that's part of our surveillance and containment strategy that we must demonstrate through this attestation as well. We have to be able to have enough contact investigators so that if there is a suspicion that someone has COVID, or there's a risk that someone's positive and there are several contacts, we have sufficient staff trained for contact investigation to be able to contain an outbreak. That's the containment piece. The mitigation piece is keeping those individuals at home that are still at risk, those over 65, and being very strategic about what we do open under the accelerated path, what is safe to open in our county and what is not.
All right, thank you.
Thank you for your patience, and we have several, actually Supervisor Morris, Finley, and Brown all have questions on that same topic.
Sure.
Please.
So I think you answered my question a little bit. We're still in tier 1 testing, which you described. At what points do we flip into tier 2?
So good question, Supervisor Morris. Thank you. So they have changed the prioritization under Tier 1, 2, and 3. So Tier 1 includes everyone except those low-risk asymptomatic persons. So the low-risk asymptomatic persons are Tier 2 now.
Okay.
That's all. Tier 3 is public health surveillance on anybody who needs testing.
Okay.
So Tier 1 is virtually everybody else.
Okay, so, and then back to something you said earlier when you were going through the numbers of tests. Do you feel comfortable in our capacity to hit the numbers in testing that is required for this accelerated program that we're in?
Yes.
Okay, that's what I wanted to know. All right,
Supervisor.
doesn't mean we have to do it, just that you can do it.
Capacity, that's right. Thank you.
I guess I'm pretty much more interested or curious about whether you're going to be testing for antibodies or current infection. Do you have a choice, or does one test cover both of those?
Well, that's a really good question. Thank you, Supervisor Finley. The PCR, the molecular PCR
Right.
test is the one that amplifies virus. That's the one
Right.
that based on the swab, and that just tells you qualitative whether it's positive or negative, meaning they have acute illness. They either
Right.
have acute illness or they don't. The antibody is the serology test.
Okay.
Yes.
And which will we be getting, or is it a
It's the
toss-up, or are there none available?
So we do, the PCR testing is the one I'm primarily talking
Okay.
about. The serology testing is available in limited capacity,
Okay.
not widely in our county or surrounding areas. There's still a lot of work to be done on that.
So we still have a lot of exposure in what's going on. Thank you.
Supervisor Brown?
I was just curious if that, I think you said it was 1.5% for every, for the population is to have the monitoring amounts, that's to the 26 tests per day, that from Tuesdays.
Right, it's 1.5 per 10,000. Yeah, or per 1,000, I think. Yeah, I calculated to be about 26, 25, 24, somewhere in there. Same thing, I really don't see a problem with us hitting that capacity. It's just we're not going to be able to do it tomorrow. And I don't think there's any indication in the attestation that we have to say right now, we're testing 26 people per day. It's just capacity to do that by what I've laid out, the plan for those testing sites.
And will we ever be requesting that people come in and voluntarily get tested, or is it always?
That's part of surveillance. Yes, and once we have the capacity, strategically, absolutely, we'll want everybody that wants a test to get one. We're just not there yet. We want to do it very strategically on who's at highest risk.
Thank you, Marcy. If you can please continue where you were.
Oh, I honestly think I've addressed most. I'll just go through the things that maybe I haven't addressed. So the containment capacity, I talked a little bit about with Supervisor Groves. Basically, it's for counties that have no cases, we have to be able to demonstrate that we have 15 staff per 100,000 persons as trained contact tracers. So that's roughly about 2 persons in Trinity County. We have that right now. We have 2 very competent nurses that I'd like to give a shout out to, census nurses. To Mary Baracco and Melissa Avila. They're amazing. They've both been trained and are able to do contact investigation. I'm also trained and able to do that, and we've got about 4 deep, 5 deep, and others that can be trained. It doesn't require a nurse to do contact investigation. It does require a nurse to do case investigation. That's with a confirmed case. The nurse has to do that contact and case management. But the contacts of the positive person can be done through others that are non-nurses. So we do have that capability. We also must have the ability to demonstrate that 15% of our homeless population has the ability to be sequestered, quarantined away from others in the event there's an outbreak in that population. And essentially all I'm waiting for is to determine what population count they want to use for that. But we have the Room Key project that stood up and we'll be laying out how that meets the criteria for that. The hospital capacity requirement includes adequate supplies of PPE for hospital staff and a county, hospital, or regional capacity to accommodate a minimum surge at 35%. We do have the ability to do that through a variety of means, working with partners, and some of those federal medical sites in other counties. We do have an alternate care site capability of about 20 beds. They're cots that we could stand up if we had to at the Veterans Hall to decompress hospital surge if they had less acute patients. That's where we would open up our alternate care site for those persons that don't need high acuity nursing care. So we do have a plan for that, and then we're capable of addressing that.
You said 35%, 35% of what?
Of their normal, of their capacity.
Okay, thank you.
Yeah.
Marcy, didn't you bring in some mobile pop-ups as well?
Yes, yes, those are, we brought those in, Supervisor Chadwick, for primarily triaging, having an isolation unit outside of the clinics and the hospital to be able to triage symptomatic patients and prevent spread within those facilities. The clinics have done an excellent job of managing that and haven't really needed those. We can use those for that. They're a little bit different than our alternate care site with our cots in that they'd have to supply the gurneys. There are no cots that hold with those, so there's some just logistics around that. But yes, those can be used for that. Yeah. One of the other things I wanted to address, Supervisor Rose, in answering your question, I didn't mention we're working also with the jail commanders. We have a meeting to meet with jail staff to start to get our inmates tested and our jail staff tested. And I know that the question has come up that there hasn't been a new inmate coming into the jail in 2 weeks, but staff come in and out of the jail, and it's possible for a staff person to bring COVID-19 into the jail and then have an outbreak in the jail. We've heard that going on nationwide, so we're paying attention to that. Want to make sure our inmates and our jail staff are tested as with our other law enforcement essential workers. Vulnerable populations, a determination must be made by the county that the proposed variance maintains protections for vulnerable populations, particularly those in long-term care settings. For example, ensuring skilled nursing facilities have a minimum 14-day supply of PPE on hand. We've met that threshold. We continue to work with the hospital, and a lot of this depends on the hospital and why it's so important to conduct that in partnership with them and have a letter of support from them. Triggers for adjusting the modification. We have metrics that we're using to monitor COVID activity in our county as we open up these businesses. And our trigger, we've identified, for example, 2 positive COVID cases and reconvening and looking at, it'll be a decision-making process. So looking at where the outbreak happened, how it occurred, tracing the context, what the risk is based on the contacts, who they're contacting, and whether or not we want to modify those orders to contain any further spread. That's basically all I have. I'm happy to answer any more questions.
Will we get into timeline of this later in this program, or yes?
Yeah, I think what we'll do, once he's done, we'll go to some public comments or boards. Okay, so a question for, yeah, we will get in towards the latter part of discussion, so we can.
Go ahead. Yeah. So I follow everything you said. Great, thank you, Marcy. So as we move, that is to establish and justify our acceleration within phase 2 for counties such as ours. Not every county gets to do this, I understand. There's about 28 of us in the state that can do this if we meet the criteria as you lined out. So we've heard the state talk about the phases, and I'm reading in the backup, we're kind of moving into low risk, medium risk, high risk, and those type of business nonprofits fall within those levels. Currently under phase 2, without the acceleration, they're saying retail needs to just be curbside. So are we saying now if allowed and prove our case to the state, our retailers could open their doors, the non-essential, keeping that group of 10 or less in social distancing? Is what we're allowing?
Yeah,
Okay, because I've not seen it really jump out at me, but it could be me.
Yes, I don't have my notes in front of me, but they're on the website, on COVID-19.ca.gov website. There's that web page that has the 1, 2, 3, and it lists under, if you go to that, it tells you within the accelerated, like right now we're just the curbside, but then it tells you in the accelerated. So it's my understanding there are allowable modifications that still would require the ability to social distance.
Yeah, of course.
And so, as a county, I wanted to make it clear that we don't have to, if we decide, for example, that, and I'm just using this as an example, that restaurants might be a higher risk area based on our county and what we deem appropriate, we don't have to accelerate to that right now. It might behoove us to accelerate in the safest way possible with the safest businesses, and then monitor that for 2 weeks, because it's really that 2-week period that you're going to see perhaps new cases come out because of the incubation period. And then after the 2-week period, go on to the whatever we decide. You just can't go to phase 3 until the governor states that you can.
Of course. So I'm just talking in phase 2. So even though, so I guess I just don't, it's not in front of us, or if I was a business owner, what I would be able to accelerate into, whether I was just a straight ahead retailer, if I was a restaurant wanting to offer some in-seating dining, it's not in our backup. So I don't know where the public would, except filling out the information, where they can find where they can do, whether it's tomorrow or Tuesday or.
So I think what I'm going to do is, I think Richard and Christy, I know that there's a requirement for businesses to complete.
Right.
And I can't speak to that.
Okay.
I just know that there are a lot of nuances that are going to go on. And the important thing about the attestation is that there are 2 pieces. The attestation is the health officer's sign off that this is what's safe to do in Trinity County. And it will be public facing, so there's no approval. We don't get approval from the California Department of Public Health. It's very much like our businesses are doing, where our businesses go in, they fill out their safety plan. That's what we're doing for the health department. That's our safety plan, saying how we can do this and keep people safe at the same time. So it will require some thought and some discussion around what is safe in our community to open in an accelerated way under phase 2.
And I will say that last night I checked, and on trinitycounty.org, there's a list in alphabetical order of yes, you can apply, or no, you can't. And it just goes down A to Z. So thank you for putting that out for those who didn't know that.
Yeah, our director, Elizabeth and Christy, everybody's done a really amazing job. I'm so proud of us.
Supervisor Brown?
Good job.
Okay.
I'll wait until I think Supervisor Rose or
Supervisor Finley?
Actually, I kind of need a little bit of direction. What is our intention? Is it to open up the county and invite the rest of the world in? Or is it to allow residents to go in and, I know never get a haircut again, but eat or just our residents go and buy shoes and have delivered curbside? Or are our constituents hoping that everyone is going to come in and start buying in Weaverville again and move forward? What is the board's intention? What is the state going to allow us to do or not do? And what is the public's perception of what we're going to be allowed?
I believe under the phase 2, Marcia, correct me if I'm wrong, or even actually Sheriff, correct me if I'm wrong, that the travel restrictions, there is no travel restrictions, there is strongly discouraged unnecessary travel. Now the sheriff cannot enforce strongly discouraged. So that's really going to be on the onus of the individual to determine whether they're going to leave their county and come to our county. Currently we have our 14-day quarantine, but with the new move into phase 2, I believe when the doctor creates a new order, that will be eliminated. That was in our discussion, was it not, Marcy? Yeah. So we will still have discouraged non-essential travel, but that's not enforceable. So those that want to travel to Trinity County under phase 2 through the governor's orders will be able to do so.
John, I'll throw this out right. My biggest concern is that the public from out of the area is already traveling here. And I came in today, I passed probably 125 cars coming in along the lake, boats, campers, RVs, bicycles, motorcycles, it was all being packed in. So they're coming, we have to figure out how to keep the county safe. And so
Exactly. So are we doing that? Is that part of the intention that is important for this board to move forward with? And is this taking that into consideration? And is the public, is that the direction that they think we're going in, or is it just open up so we can go back to life as normal?
Having the conversation with the health officers just a few hours ago, Doc is very, very concerned with public safety first. He understands there's an economic issue to this, but his concern is preserving life first. So that's what, as we create these plans, he's the one who will sign off, and if he's not satisfied that we are mitigating the risk, he won't sign it. So that's what it'll come down to, is his approval of our mitigated risk.
Exactly, and I think that's the most important thing, and that's what this board should consider, and what the public needs to understand, that this is what we will consider, and our main intention, other than just back to economic growth of the visitors traveling through Trinity County and trying to capture every dollar. Supervisor?
Maybe he was in front of me. Were you?
well, I thought maybe this would be an opportune time for the discussion to explain to people that the board doesn't have authority in this.
I actually think what I'm going to do is I'm going to ask that we conclude with the presentations and then continue this conversation, because I think we're missing a couple pieces. And so if you feel satisfied with Marcy, I'm going to just have her sit back in the audience. But I think Dr. Coons has some updates. I think he has come across some information on another county that did open up and what the ramifications. So the presentation, I think if we can conclude it, and then we can have a better understanding of the whole picture.
I just want to clarify something. I'm fine.
Go for it.
I'm fine with Marcy. I think today's action is, the state says we can move to phase 2, every county, to how they'd like to move forward. And then we get the opportunity to open up a little bit under phase 2. We don't get to open up completely. And I think Marcy spelled out some things they'll be watching as this slowly phases in. And so I just want folks to understand this is not like lifting everything. The state hasn't lifted anything. So that's all I'll say at the moment. I may have questions.
Marcy, don't go too far in case we need you. Please.
Oh, I'll be right
Thank you. I appreciate it.
Stay at the county.
Yeah, as we mentioned in our presentation on Tuesday, which was like 2 weeks ago, that we need to be careful how far we go, because if we step outside the governor's orders, there could be consequences to that. And I received a letter today that was addressed to Modoc County, who did do that, and they're being threatened with sanctions from the state to withhold some of their funding. So we do want to keep that in mind, that this is state-driven, this is not county-driven, and this is medically driven. So to Supervisor Grove's statement, we are not asking the board for permission to do so. We're asking the board for the support to have staff work with the medical team to move forward in a manner which is safe for the community. So no, it's not a direction from the board. It will be asking staff, asking the board to support us moving, because we are qualified in phase 2, moving to the accelerated program, as long as we meet all the criteria of the phase 2, which allow us to move a little sooner. So we'll kind of redefine that as we get to it, but no, your point is made, and I hope it is clear to the public. This is not the direction of the board. This will be the direction of the medical officer, with the support of the board. Yes, sir.
No, they're working on the roof.
Sorry, for those on the phone who cannot see us, the background noise is that there is some construction on the roof. So, thank you. So, Was there anyone else, Christy or Liz, that wanted to address the board at this time?
Hello. Christy Anderson, Trinity County Environmental Health. I just wanted to give you guys an update. We are getting a lot of hits on the website, or on our email. We've received over 45 business plans, and all of those received before 4 p.m. yesterday were issued a certificate of compliance, or they were told they're part of phase 3 and we can't issue it yet. We are keeping them updated, and it's really nice when we have a nice list of emails to do so. It makes it in real time rather than trying to find every business and let them know when it's time. So as Bobby mentioned, there's a list of businesses on the website that say yes, curbside only, and list their current restrictions right now. That'll change as we move through. Not necessarily that they can't apply for a business plan, but it kind of shows where they're at, and that way they don't have to question whether or not they can open their doors.
That was business types, not the actual businesses themselves.
Correct. In alphabetic. And can you reiterate that there is no cost to the business people, because that question has come up?
Oh, yeah, there's no cost to submit your business plan, and it's laid out in a way that is very user-friendly. I would encourage any of you, if you want to try it out, just put test on there, or business owners like Supervisor Groves, fill one out, or county agencies. Yeah.
Supervisor Morris? Did you have any?
Yeah, just real quick, when our resorts go on here, do they qualify under the hotel motels? Is that where resorts go?
Yes, that's where people have been submitting them. Some resorts actually entered under recreation. That was like a marina entered under the recreation. But they received a certificate of compliance that's restricted at this point. That was Trinity County residents or essential workers only. However, they'll be updated as everything changes.
Thank you. Supervisor Morris?
This is probably a variation on that question. So those in phase 2 currently, retail, currently the state says curbside. But as we move forward, if later today or Monday, will it change to the accelerated program for those retailers who can operate with under 10 people, customers, employees, on non-essential retail?
When it's allowed, it will update on the website, and we will be sending out modified certificates at that time.
Okay, and when does that typically happen? Because we're getting a lot of questions
About timeline?
well, yeah, since we're talking about acceleration today, somebody at retail might say, well, when can I move into that phase of phase 2?
I can't answer that question.
Do we have to wait on the state to give us a thumbs up?
I'm so sorry. Thanks, Christy. I'm so sorry, Supervisor Morris, I didn't hear the question. Are you talking about timeline?
Yeah, we're trying to, we're going to walk out the door, our phones are going to ring.
Okay, sure. There are hoops that need to be jumped through.
Okay.
One of them is it's required that our health officer have a phone call with the California Department of Public Health.
Okay.
Letting them know that we will be attesting to that. There's a 12-page document that must be filled out to, in detail, describe how we meet each of those criteria. I'll be working on that today and this weekend to see if I can expedite that, and then having a technical assistance call with CDPH. I did hear the governor talk about, early next week, this beginning to roll out, so I'm hoping it doesn't take too much longer than it needs to. We'll do it as fast as we can.
Okay, but in the meantime, they're under phase 2 currently and could sell curbside after today. Do I understand that right?
Yeah, today the governor has opened up the retail curbside pickup only and the manufacturers that support those businesses.
Supervisor Brown?
I just received a couple calls, not just at this moment, but the last day or two, about businesses and the requirement to put up the poster on the front window, and I guess their concern was that, if their business is open, they felt like that was the assurance in itself, and that people that are willing to enter the businesses are aware that they are either one, taking that risk, even though that if a business was opened, it's assumed they're following all of the COVID measures that the website's making be allowed. Is the state requiring that businesses put up posters in their windows, or is that a county specification we've made?
This is a county-specific measure. We're using that to meet our criteria for sanitation practices, et cetera, by businesses. It was in hopes to give patrons some incentive, or to give businesses incentive by patrons knowing that they're taking those extra measures.
Okay.
We will have an active list on the website once we get that going a little bit more on who has those signs. We're hoping, that it will promote people to want to follow those guidelines, but also give patrons a little more confidence in going to those destinations.
Thank you.
Supervisor Finley, do you have any questions?
Nope.
Okay,
Thanks.
Supervisor Groves.
Yeah, so I'd asked the question the other day, and I thought I saw it. Do all businesses now have to do this?
Yes.
So the essential businesses that have been operating now have to do this before they can operate?
I think a lot of them will want to. We're getting a lot of people that are already open that submitted theirs, and because they want that sign to put in the window. It really is, I think, mutually beneficial.
So if they don't do that, then the essential business is, because I read someplace in here, we're going from essential, non-essential to low risk, high risk.
We are moving that direction.
We'll reach out, those businesses that were essential and haven't filled, we'll reach out to them to encourage them to complete the business plan.
I'd like to invite Marcy up. I can see she has something to say.
I'm just so sorry. Supervisor Gross, that's an excellent question. We've been working all along with essential workers. When they first opened, we've been working all along with them to ensure the safety within their facility. Before it came about the idea of having these as we open up, because essential is essential. Remember, in the first phase, it was essential versus non-essential. Now we're moving to safe versus unsafe businesses. So we want something that demonstrates safety and that they're paying attention to this. Our essential workers were brought along with that early on, the sanitation and things like that.
Supervisor Morris. Oh, I didn't see that at all.
I'm sorry, I'm hogging all your time.
Used to it.
So I would recommend, I don't know how many cannabis areas you've been to, but I would recommend that we, through the planning department, notify the 400 licensees that they need to do this also.
That's a good point, and they are on the ag portion. That's one of the main reasons why the ag portion was mentioned. It's hard without a business license to find every single licensee, or every single business. But most of the essential businesses were covered. They had some kind of health permit, so that was really easy to reach out to. So we'll work with the planning department and try to reach out, because I think the word just needs to get out more.
You're not the first person to mention businesses.
Supervisor Morris, I think.
Yes.
Okay.
Thank you. I certainly, in my district, get a lot of questions about restaurants, and certainly they are still in that curbside takeout mode. If I recall, an accelerated, is there an accelerated portion for restaurants once we get the approval and they can demonstrate safety for either outside dining or within the restaurant?
I think we'll have to really take a look at how we'll move forward in that, but I think it is mentioned in one of the tiers.
So I don't know if I'm going to just, I wish I had this when I was up there, I'm so sorry. Let me just tell you what is in the later stage that's outlined on that website that will hopefully clarify. Destination retail, including shopping malls and swap meets. So when we accelerate, these are the things we could open if we deem in our county that it's safe to do so. Destination retail, including shopping malls and swap meets. Personal services limited to car washes, pet grooming, tanning facilities, and landscape gardening. Office-based businesses, telework remains strongly encouraged. Dining and restaurant, but other facilities and amenities like bars or gaming areas are not permitted. Schools and childcare facilities, again, may, outdoor museums, and open gallery spaces. But again, this is what's included in the whole of Phase 2, and what we could, if we deem safe, accelerate and open once we attest and create this plan. I'm neither advocating for nor against. I'm simply stating we have to look at what's safe to do so.
Then I have a separate question. And these are questions that were generated from our discussion on Tuesday. So the public has a lot of questions. We know certainly large events are not going to happen anytime soon, but certainly churches are in the Phase 3 as deemed by the state. But if we look at through the lens of risk, low risk, etc., the small groups, the small churches, are they able to be in Phase 2 with acceleration? In Phase 2 as under 10, 6 feet distancing?
You know, this question was a point of contention for many health departments on the call last night. And I honestly don't know how to answer that. And here's why. It depends on the governor's position, because we know that there are some consequences now to getting sideways to the governor's order. So we honestly do not know the answer to that yet, because churches are not explicitly included in Phase 2, but neither are gyms. And so uniquely, what does that look like in our county? We can use common sense and apply, okay, if this is safe, then why isn't this safe? It's just a different entity. We just have to make sure that if we're going to do that moving forward, that there won't be ramifications because we're not complying with statewide orders.
For sure, and I appreciate that and wouldn't want you to do anything different. But my sense is this plan that you're going to submit, maybe it would be included, hey, we're thinking of this because we're one of the 28 counties that has some flexibility. What do you think? They can say no, whether it's the gym or small groups in churches or whatever.
Yes, we can absolutely do that. That's the whole purpose of the attestation.
Right.
Yeah.
Okay.
Supervisor Brown?
I received some inquiries about masks and masking the public, and a lot of people feeling masks are not being worn in the public. And I just want some clarity. Are masks mandatory for the public to be wearing?
The mask, to make the masking mandatory for the public, it will require a health officer order, and our health officer has not ordered mandatory masking.
It's the pleasure of the board if you're going to take public comment, and then we can answer some more questions.
I believe we are done with our conversation with yourself, so thank you. Tina, I turn it over to you.
And we can
Do you
let
want-
people know that if
Do
they
you
don't
want
understand.
the Zoom to go first, or do you want the phone to go first?
We haven't had the phone, not for the Zoom, or if they want to raise their hand, it's
It doesn't
9
matter.
star or something like that.
It's star 9 if
Star
you're
nine.
on the phone, if you want to raise your hand.
So I am being told that if you want to raise your hand on the phone, it's star 9. Tina's monitoring the Zoom lens, and so please state your name so we know who's talking, and we're opening it to public comment. Welcome to our meeting. Veronica? Veronica Kelly, you're on.
Thank you. Veronica Kelly Alves, from Weaverville, Douglas City Parks and Recreation District. My question is for natural recreation. You may have heard that the Reading Aquatic Center is being given approval to move forward at the end of May. But facilities like ours that are part of Phase 3, are all Phase 3 facilities and businesses going to be considered for acceleration into the Phase 2? And because I am hearing some of the resorts have already been given their certificate of operation under the new guidelines, and there's some discussion about their pools being open next week. And so I just wanted to see where we're at with Phase 3 businesses, and if they're going to be allowed to and I've got my plans and all, and I'll do it online, but how that is going to work.
So you cut out for a moment there, so you're asking if any stage 3 are rolled into the stage 2 opening? Is that your question?
A little bit. The Lavenport pool would be part of phase 3. What I'm asking is, are businesses like myself that could meet the safety requirements that could be part of accelerated phase 2, are those being considered at this time? As you may have heard, the Reading Aquatic Center is opening at the end of this month. And some of the resorts in our Trinity County have already been talking about their certificates that they have received and their pools possibly opening next week.
So I'm going to have Christy Anderson respond to that.
Hi, Veronica. So I know that I've already reached out to you a little bit and we haven't had our meeting, but pools are definitely being looked at right now, and we are taking into consideration safety measures that would make it safe to recreate in a pool. As far as anybody giving the green light to open their pool, that hasn't not been done. But I think it's really important to work with you in Hay Fork, as you guys are our biggest public pools, and move forward with the safety program. And there's ways that other counties have figured out how to do so in a safe and legal manner. So we'll definitely be looking at that.
Mr. George Bates, you're next.
Good afternoon, supervisors. Thank you for doing this. Can you hear me well?
We can hear you, but
Hello?
it's very garbled up. If you could, if you're on speaker, if you could take your speaker off and talk directly into the telephone mic or the computer mic.
Maybe I'm going to have to call back on the phone. Is that better?
No, don't.
Oh, no, I can't hear you though.
Can you call back on your phone?
I'll back off the phone because if I turn my speaker off, I can't hear you, so it doesn't do me any good.
Okay.
It's working almost.
We'll rotate you back in. We're going to go forward with someone next. We'll rotate you back in. So that's an easy rotation.
Wait, let me call some friends. You'll see.
Back on. Okay. Mr. Bates, right? Mr. Bates, are you there?
Is it any better?
Not much. Can you just try to speak very loudly?
Okay. We'll try here. First off, I want to thank you all for doing this. I looked at the health department report, and I thought it was really excellent, but they lay out and everything. My big concerns are the same things we've done down here and being able to actually do those things at the current point. Because we talk about testing and contact tracing and all those things. And above it says that we need to get these 6 things, basically indicators modifying to, approve, to get the stay at home order changed. So I don't see that we're actually meeting those things currently to do that. The other thing is I have big concerns about the requirements of no mask. There didn't seem to be anything I could find about masks being in there, that we have
a requirement for people to wear masks entering stores or not entering stores. There seemed to be like this vague suggestion of an image of a mask, and it said, you know, like, well, it's kind of you, kind of, you know, I'm paraphrasing it, but that's what I saw. And, you know, as you know, both the president and vice president have had people in their offices recently, in the past 2 days, have coronavirus. So this is a thing that's really out there. And oh boy, my birds are going up, I'm sorry. And also, all right, that's it, I'm sorry.
So, Mr. Bates, it's very difficult to hear you, so what I'm going to ask you to do is if you can send your email address and a telephone number with those questions, I'll make sure that someone who is more knowledgeable than I respond to you personally. It's just too difficult to hear you, and I apologize for anybody else on the public that has those same questions. It's just, I'm not sure if the question if we're hearing it. So if you could please email me or
ask.
Yeah,
I got 2 distinct questions.
What's your email?
He's asking.
B. Chadwick at trinitycounty.org. Supervisor Groves believes he heard a couple of the questions, so we'll address what we think we heard.
So one, he had the question asked.
Thank you.
And the first question was he felt that we haven't met the criteria to start this phase 2 yet. So he was worried about those criteria being met before we start this process.
Okay, so Marcy?
Thank you for those questions. So, meeting the criteria is a capacity issue and a right now issue. So, right now, what we've done all along behind the scenes in public health that we do in any disease outbreak is we have a plan that we use that doesn't change. The difference between this is that this is a pandemic and it utilizes many resources throughout the state, the county, and the federal government, which makes it more challenging. So what we do on the backside that our public may not know about is we are continuously monitoring. This is a form of surveillance. We are in continuous contact with our medical providers and others to monitor people that may have been exposed to this illness through whatever means. Early on it was through travel. Then it was just simply the symptom picture, and that even broadened to potentially being in a place where they could have gotten it and having a high degree of suspicion around that. Testing those persons. The problem with early on, the testing supplies weren't available to test as broadly as we needed to. That problem has been solved. On the other side of that, we have a mechanism that whenever a provider tests for this illness, they send what's called a comorbidity report to the health department. That's a form that's kept confidential, absolutely confidential. It's in statute that we're allowed to get that information, and it tells us the person that's being tested, and then we conduct outreach to that person to find out how they're doing, first of all, and then to find out who their contacts are. That's the essence of the contact investigation. So a lot of these things that we're asking to attest to, we already do on a regular basis in the health department when we approach outbreaks and illness. The difference here is that the capability is larger than what's the ability normally of the county capacity. And there's been a limited supply of resources available to do that. So now the government's stating, and here's the key, that because we don't have any positive cases or we have low positive cases, right? We fall under the no positive cases. But for counties that have very low cases, that means that we've done a fairly good job of containing it. That's why we qualify for this. So in a nutshell, that's kind of the essence of where we are, what we've done, where we're moving to, and why we can move to there. Now, with regard to the masks, we absolutely continue to recommend, as the CDC and CDPH do, that individuals wear a mask out in the community, a face covering, a mask. Remember, the more people that wear masks, the less transmission there is. If you wearing a face covering or paper masks prevent a person that may have it, not have symptoms, or have symptoms from transmitting it to others. If everybody has a mask on, there's going to be very few people that can get it. However, to have a universal masking policy, people have the right to not put something on their face. And so to insist that people wear a mask out in public would require the health officer to write an order. We know what those orders look like. We have orders in place that restrict people's rights to keep them safe. We only do those when it's absolutely necessary. At this point in time, if we do this right, with the policies we put in place and the acceleration that we do and doing it safely, we don't have to mandate that everybody in public wear a mask. We would continue to recommend that, but it's not going to be an order that our health officer is going to write. I can assure you of that.
Thank you, Marcy. That was really good. So, are there any more public comments on Zoom or the phone? No? Okay, so we're going to, oh, Mr. Tippett, I'm sorry. I saw you right now.
Vic Tippett, Director of Transportation. I just wanted to remind the board that we want to keep transit drivers as a high priority for testing. They're right now considered one of the most dangerous jobs outside of a hospital because they're potential for exposure. So I'd like to just say that. And then one thing as a personal, on personal level, living out where I live, we've had a lot of folks come to their secondary homes from outside the area, and they do not follow the health officer's orders. Matter of fact, I saw one set of folks show up, and they immediately got in a car and ran down to the neighbor's house and pulled the neighbor back in with their little gator. And so they were immediately socializing in the neighborhood right after they showed up from an area that has a high count. And it was upsetting for me because, you know, then they're petting the dogs, and it's really easy to be conveyed. And you're bringing it here, and if you get sick, you get to go back home to where you came from, where all the nice hospitals are, but we don't get that option. I thought that was kind of unfair for them to be doing that.
Any more in the audience, public comment? Okay, now I'll bring it back to the board. Just because you're here, this, and did you want to add, Sheriff, did you want to add to this presentation in any way? I don't want to cut you off. Thank you, Sheriff.
Madam Chair, Board, just a couple of comments. Number one, to address Supervisor Finley earlier, I don't think the intent is to raise the flag over Trinity County and say, California, we're open for business. That's not the intent. I do want to say that over the last 2 weeks, I've had the pleasure and honor to work with the CAO's office, Health and Human Services, Public Health Branch, Marcy's been great, Christy from Environmental Health, and I want to tell you, these individuals have been coming to the table with questions, answers. We've been working diligently to try and figure out how we can not only protect the people of Trinity County, but also help the people of Trinity County, the business owners of Trinity County, to open up and move forward. And I think we've come up with some great plans, some great ideas to move forward.
As your sheriff, I've constantly come forward and said enforcement is not the issue. It's education, it's socially telling people, be smart, follow the rules, don't be stupid. We've got to continue that message. I understand we have people that are coming up here. The weather's nice. They have second homes. Mr. Tippett came up here and he's talking about stupid people that come up here. We can't legislate stupidity. We've tried that over and over. It doesn't work. Marcy talked about the issue of making masks mandatory. Every time you lay down the law, you say you shall do something, there's going to be people that fight it. We can't enforce that. What we're coming here today, and the plan that's been introduced, and this plan for accelerating stage 2, I think the group that's put this together has spent a lot of time talking about it, thinking about it, and has made a great plan. And I just hope that you look at it, you support it, and give this an opportunity to move forward. I think it'll work. I think the bottom line of this whole thing is, again, not to raise the flag and say, come here, bring everybody to Trinity County. It's to give the residents of Trinity County an opportunity to get back into business and to support our local economy. Thank you.
Let's take it, because it's the technicalities, we don't.
Close about.
Pardon?
You haven't closed.
Okay, thank you, I wasn't sure if I had. So there was somebody else that just, Marilyn? Brown.
Third person.
Brown. Can you hear me?
If you could speak up a little bit, it'd help.
Can you hear me?
Yes,
Can you hear me now?
yes.
Okay, I had a question along the line of dates. I go into the nursery, I went into the Ace Hardware nursery once in the post office, and I think I saw one other person wearing a mask. The clerks were not wearing masks. My husband does the grocery shopping once a week. I'm over 70. And I understand the problem with people not wanting to be forced to do something they would normally do. However, I know they tried getting people to have to wear masks in Illinois. And when they came into the shops, the people threatened the clerks who required masks. It seems to me that when somebody goes into a building, and I'm talking about, some of the stores here, now maybe this won't happen because it's curbside, they're really small. And even in the nursery, if you're walking down one aisle, somebody can be walking down the other aisle across from you, and they're not 6 feet apart. The signage in front of the nursery is hidden by, it's kind of on the side of the gate, so you wouldn't even see it unless you were really looking for it coming in. I think that there are two ways to do it. One is full force, and one is some kind of signage, social pressure encouragement. If people inside the stores, or if anybody's going to go in, had a sign for my health, please wear a mask. If there were signs around town, we highly recommend masks so that people start thinking, oh, maybe this is something we should be doing. Because, for example, if you could go into the post office, except for a couple other people down there I see, nobody's wearing masks, and everybody goes in there, and everyone's walking, around each other. So, I guess my point is, could there be signs encouraging people to wear masks, letting them know
that it's protection for the people that are trying to serve you and for the other people in the community, using positive ways of trying to promote the use of masks. I think we got a political thing here where, oh, it's not, you know, if you want to be a badass, you don't wear a mask, right? So, but if you say, well, you know, we care about our shop owners, we care about whether they go out of business or not, and we care about whether they die. So for their sake, would you please wear a mask? And for your friends who you may run into in the stores, would you please wear a mask? And that's, I'll quit.
Thank you, Mrs. Rounds. Is there anybody else in the public? And then we'll bring it back, and then Judy will have you respond. Is there anybody else in the audience? Okay, so I'm going to bring it back, and Supervisor Morris, you have a comment on masks?
Yeah, in general, it's taking off what the sheriff said about education and communication. As we have more people coming to the county, that it does give me a bit of a worry. And so anything we can do to, we've talked about this before, the sandwich boards at key retailers, to remind our visitors and our residents of some of these key points. Just in general, I don't think we can slack off on any communication or education that will help keep everyone safe.
Supervisor Penny?
Does the health officer recommend in his request that we wear masks? Is that part of his?
Yes, it's a recommendation that people mask. And it's always been a recommendation. And when I really appreciate Mrs. Rounds, your point. It's well taken. Something I wanted to share is we have about 2,500 masks that we're going to be providing to businesses to have available to people that come into their places of business. And it's to help in that exact situation, Mrs. Rounds, your point is well taken. The other thing I wanted to share is that, you know, we can take some, we have some control over this as well. If we're in a store and I've had to do this even though I've worn a mask, is I wanted to test this. I've maneuvered to see if I can stay 6 feet away from other people in different venues. And it is possible. It takes longer to do your shopping, but it is possible. And so we would ask our citizens just to be mindful about not just the masking, but the 6-foot distance and just being mindful of those around you. And so I just wanted to share that so you all knew that.
Please don't go away, because I have a feeling there's a lot of follow-up.
The biggest complaint, Marcy, are the arrows on the floor and people don't follow them. It's, I mean, fist fights. I've seen, or I've heard about. Ex-Trinity County residents in Reading, they're ready to go for it.
Oh my.
Yeah.
So Marcy, I know we've had the conversation around mask and moving into fire season. My concern is we have no inventory. So as a county with volunteer firefighters putting the red flag up saying, hey, we need personal masks, I think that's our priority going into fire season as well. And I know I've mentioned it to you at Disaster Council as well. So it seems complicated if we request somebody to wear something that we can't provide and that they can't get. So
correct.
I know that there is a shortage. I know, and like I said, the smoke comes with fire, and hopefully we won't have a fire season, but that is a concern, just having the mask. And again, I bring it up because the public's brought it up for the COVID, but it's more than just for COVID. It's for our men and women that live and devote their lives to protecting us, and they don't have any.
Yeah, so thank you, Supervisor Chadwick. I did, on Tuesday after you raised this concern, I went back to the Mohawk and we talked about it, and we know that the TCLS is helping as well with PPE for our volunteer firefighters. But those supply chains have gotten a bit looser, so we do have the ability to ensure that PPE goes to people who need it. We've secured some funding through our grants to do that. So we just need to hear from them how much is needed and whether or not that's not being served through another avenue. And so absolutely, and that's the other reason, yes, asking the public to wear masks, but them not having access to them. So that was why those 2,500 masks are going to be important to provide our business owners. And we're setting up a throughput for that, how they can order those and get those supplies.
Perfect, thank you. Christy, did you have something?
Yeah, I just wanted to mention with that certificate of compliance, one of the requirements is signage. And actually, as you're applying through the business plan, there's check boxes that you have received these posters. So we created those signs for masks encourage, social distancing, and stay home if sick, and really breaking it down. So that's one of the other caveats that goes with having that compliance certificate.
Thank you.
You're on top of it. Thank you.
Ms. Hamilton, did you have anything to add? No, not today. Thank you. So, Dr. Kearns?
I think this is when we bring it back and clarify what we're asking of the board, and I'm going to recruit Margaret because she's always the best at verbalizing what the motion may be. So at this point, if I can bring Margaret in, because I think she has a good understanding of what we're asking of the board. We're not asking the board to approve a plan. We're asking the board to support the health officer and the medical professionals to move us forward through phase 2 into the accelerated with meeting the criteria. So are you on there, Margaret?
I am, yes.
How do you want to verbalize it?
I was going to say, I can do it, but you just articulated it very well. So I don't know what else I can.
I don't remember what I said.
Sorry. Now the public will buy it.
So if I can just jump in and pretend like I was the one that had the brilliant idea. So the way that the state has set it up, this is a decision that is made by the health official. It's not a board decision. It's the walking through the process, the attestation and plan is something that we need to make sure our health official approves of. And I know the health official worked in conjunction with staff and with admin, and it's being presented today. The board has, this is not something for the board to approve, but the board can give the support. But again, it wouldn't be a formalized approval or a vote. It would just be, support to the health officials as we move forward. Because that's what the state is requiring in order to accept it as approved, is that they just need the health official's signature.
No motion needs?
But also, I would like to say I support it.
Yeah, I was going to say, we can still ask each individual supervisor.
I'd like to know what the plan is. The backup, to me, really isn't a plan, it's just an overall view. That we don't know what happens today. We're not told what happens on Monday or Wednesday. When do we plan to move forward? We have several businesses that got messages on Tuesday that now don't seem to be in place today. I get that we're not the authority here, but it sure would be like to know what's going to happen in the next 10 days, because we're going to have some businesses opening, some not opening. To me, if I'm really confused on what we're doing, then I think most people out there are brighter than me, but I think that shows that there's confusion out there.
So Marcy, isn't the whole idea to move into this next phase and then to push forward is to continue to comply with the governor's orders? And he is the one actually navigating the changes, and I think there was 2 calls this week that have been received because he is changing them. So we could know him today, but what we're saying in support of you, we are staying in compliance with the governor and requesting that we accelerate.
And in the backup on page 4 of the plan, it talks about the employers, what the requirements will be of the employers in the accelerated portion of the phase 2, because some of this isn't in the governor's phase 1. So if you want to review that, and if you want to go ahead. I'm sorry.
No, thank you. This is a joint effort. Your point's well taken, Supervisor Groves. I think the health department, the health officer, our position is approval to move forward with the attestation process. Once we develop that plan, which is that attestation form, that process, then you need to review that to provide the letter of support for that. You're not approving it because that comes through the health officer, attesting to the safety. But we do require a letter of support, and our health officer believes that in order to have the letter of support from you, you need to have that plan in hand.
So there's two different documents here.
Correct.
One is what Marcy is talking about, that is a health officer's plan to get us to be able to utilize this document, which would be the plan to move Trinity County forward. So it says on the employers, the business classifications is low risk.
I've read through that, and I understand what you're saying, but the businesses are going to want something specific. So when will that plan come forward? When will it be sent to the state? When will we meet again?
So there are some unknowns that I cannot answer. The unknowns are, I don't know the timeline for the California Department of Public Health and what backlog they have for getting a phone call with our health officer. There's a couple of, I've already, we've gotten a technical assistance call set up, and then it's just a matter of putting pen to paper and having this all written down. It's going to depend on some of our partners and their readiness. I can't give you an exact date because I wouldn't want to miss it if it took a little longer than I thought. But we're certainly hoping within the next week or so that we could at least have a finished product for you to review and to get those letters of support going. And then it's simply a matter, once it's presented to the state, it's not an approval process. Once it's posted, that means we can move forward.
Well, on Tuesday, we told resorts to go online, which they've done, and we appreciate Christie's getting those turned around. And then we told them that we're not enforcing travel risk. And there was a specific question, well, can we open by Memorial Day? And the answer was yes. And now we're obviously backing off of that. And I heard today that the state no longer has the travel ban, it just highly encourages things. So I guess I'm just apologizing to all the businesses out there that we don't have any real leadership for them at this point.
Judy? Supervisor Morris?
I just wanted to get that off for you. So next steps, we would expect to see a letter of support that you would need, or are you going to draft that with our go-ahead today for that letter of support?
I'm sorry, could you say that again, Supervisor Morris?
Sure. So after today, will you be drafting a letter of support for the state and it will just go knowing that you have our blessings on it, or will that come back to us maybe on Tuesday?
The letter of support has to be signed by the board chair.
Okay.
That's my understanding.
So she could sign it prior to Tuesday and it get ratified? Is that how we're looking at this, Richard? Or
I can't speak to that.
Yeah, sure.
Yeah, so the letter of support will go along with the plan for, and I can't say that word, but the plan, that plan.
Attestation.
Yes, that one. Will go along with that plan. That's what the board is supporting. That development after that, because again, we got to keep it straight. There's two different plans here. One is for business, one is for the medical side.
Right.
We're talking about the medical side is where we need the board support for that, for the plan that they will be submitting. The doctor and Marcy and the team will write that up. Then it's submitted to, and it's not approval, it's just attesting that we have met all the criteria, or we can meet all the criteria. So the board will be sending a letter of support with that, so the state recognizes that it is community driven.
So when do we expect that letter?
How long before the plan will be done?
Okay.
I mean, so we don't have that. Yeah, so she, as Marcy said, she's going to be working through the weekend.
Okay.
So it'll be, yeah, so as soon as the plan is ready to submit, we'll bring it back to the board. We're hoping very soon.
That's fine. I was trying to get an idea. I thought maybe we were it said a letter of support somewhere today, and I wasn't looking for it, so
We
that's okay.
hit on this a little bit on Tuesday. We didn't find out until, I believe, today what it really looks like. We were hoping it was a checkbox, that we could just check online. It's not. As you said, it's 12 pages with narratives now. So-
And I know things have
Yeah.
changed since Tuesday, so, okay. That's it for me, thank you.
No, you don't want to hear.
So I need consent, consensus, and so I'll start on the order. Jeremy, do you supporting a letter?
I do.
And I do.
I do.
Absolutely, yes.
I support us moving forward in whatever fashion. I would like to know who the contact person is to direct all the questions to.
We have,
Is that going to be Richard? Or?
we have an administrative email. Is that correct? What's the administrative email that they can send to that and we can respond to?
The reopen.
And reopening?
It's on the business website, or on the business portion, but it's Reopen Trinity.
So Margaret, while they're looking that up, is there anything else that you would request that the board get any more clearer on? Is there, how can we help you? No?
Nope, I think you guys did a good job. I think the appropriate direction was given. And I appreciate the comments regarding the state. I've been on calls all week on them, and it does appear that they are changing their positions daily, and so it is hard for public staff to keep up, but I know Marcy and folks are doing a great job keeping up with the ever-changing landscape that's being presented to us. So I just ask the board to keep an open mind that if anything does change, it's because we're trying to keep up with the state. I know our folks are working very hard.
Okay, and Ms. Hamilton is going to give us the website? Our
Business.
email address, sorry.
Correct. From trinitycounty.org, if you were to click on the yellow reopen business, it will take you, but it is reopenbusiness@trinitycounty.org. So any business can submit an email, and that goes to environmental health.
Yes, hold on.
And the list, this would be for nonprofits, I would assume too.
All business.
Even, like, I'm gonna say churches are gonna wanna know how they can operate once we're into that phase.
Great question, and yes, all business.
Okay.
Thank you. Any other questions? Any other follow-ups?
One. I don't know how easy it would be for modification on the introductory page, but if there could be something on one of the sides of the entering information that says, timing, any anticipated timing, or we cannot give you any anticipated timing. And just because when you click on the small business guidance on reopening, and then it pops up and you have to enter information, I don't feel like there's necessarily any guidance on reopening, except that you have to fill out the form. So if there can be some smaller outline of what that process may look like to them, so they don't go through the 6 pages all frustrated or not knowing what the end outcome is going to be. I don't know if that's possible or not.
Yeah, so we do generate an email, an auto reply that does give more information, but I do think what you're saying is helpful to actually have it within the document.
So we're going to go ahead and move on to closed session. Item 3.1, Government Code, Section 54954.5, parentheses E, Public Employee Evaluation, County Administrative Officer, and any public comment prior to that? Any public comment on the phone or on Zoom? And then we need to also close out from last closed session. So meeting adjourned for open session. Thank you for your participation, everybody. Pardon? We're going to do a 5-minute break and then